All right, we are gone live, and I'm going to make George the host again. Okay. So George, just make me co-host, and then I'll, and a captioner, if you can do a few tests, then we'll make sure it's live streaming the captions as well.
Look okay, Betsy?
Yep. Captioning cleared.
Great. All right. Thank you all. So Margie, we'll get started in a few minutes.
No rush. I'm just hanging out.
Okay. Thanks. Good afternoon. Hi, Connie. Hi, Margie. So we're still waiting for a few more folks to sign on, but nice to see you both.
Yep, you too. You look great. Did you hear that people have stopped getting vaccinated? They just stopped. We got about 35%, and then everybody else is going, well, everything's opening, so I guess I don't have to do that now.
They're too busy buying gas. Apparently the gas stations are going crazy.
Yeah. North Carolina's got a state of emergency.
Virginia does too.
Really?
Yeah, I just saw it a few minutes ago.
Wow.
About the gas.
I think I saw that 7% of gas stations in Virginia are out of gas. Yeah, 7%.
Wow.
I just had a friend call me and she said it was a madhouse. She needed to stop and get gas for her lawnmower, and it was, she said it was crazy.
All right. Hi, Lana.
Hi. Hello, everyone.
Hello.
So we have a quorum, so we might as well go ahead and get started. A couple of other folks may join as we go. I'll go ahead and start the housekeeping. Just bear with me a second. So good afternoon and welcome to the Alzheimer's Disease and Related Disorders Commission Data and Research Workgroup meeting. So I'll just do the housekeeping. So due to the active state of emergency, this is an electronic meeting pursuant to item 4-0.01 of the 2020 Appropriation Act. Meeting notice has been provided. The meeting is being recorded and minutes are being taken. All votes will be conducted via roll call of voting members. Meeting materials are posted under the Alzheimer's Disease and Related Disorders Commission's quarterly meeting tab at the link posted in the workgroup meeting tab. Members of the public are able to live stream this meeting via the DAR's YouTube page. Please be advised that if the live stream is interrupted, we will need to pause the meeting until it is restored. Public comment will be accepted by email or phone to my attention. Public comments that were received by yesterday, May 10th, 2021 will be read, or if lengthy, summarized during the meeting when we reach that agenda item. Go ahead and hit the Zoom items unless anybody is desperate for me to talk you through them. Just a reminder to please only use the chat feature if you have a technical issue or other issue not related to the business of this meeting, as chat comments are not captured in the live stream or the recording and so aren't available to members of the public. You can, if you'd like to view the real-time captioning of today's meeting, please click on the CC button on the menu bar at the bottom and select Show Subtitles. Zoom participants will be able to turn on closed captioning. The YouTube streaming will automatically include the captioning. For all votes, we'll do a roll call and you'll be asked to indicate your support with an A or a yes, opposition with a nay or a no, or abstain. Lastly, I'd like to thank the DARS video teleconferencing team and the DARS communication team for making this electronic meeting possible. And I'll go ahead and do a roll call of members to confirm attendance in no particular order, but starting with the chair. Lana Sargent.
Here.
Pam Teester. Carol Manning. Fonda Neal.
Here.
Connie Kugel. I see you waving.
I'm here.
Laura Bowser.
Here.
And Margie Shaver.
Here.
Great, thank you. So yes, we do have a quorum. Carol and Pam aren't here, but they might join us hopefully in a bit. I'll just pull up the agenda and then turn it over to you, Lana. Okay.
Okay, George, do we need a motion to adopt the agenda?
Yeah, do you want to welcome people first?
Yeah, welcome everyone.
Quick introductions.
Yeah, quick introductions. So skipped right over that, right to the business. So yeah, I'll start and then we'll go through who we can see on the screen. So I'm Lana Sargent. I am assistant professor at the School of Nursing, where I also have a clinical practice at VCU Geriatrics. Excited to be working in the work group today. Margie, you want to go ahead?
I'm Margie Shaver, background in advertising, retired, long time dealing with Alzheimer's or folks in my family with Alzheimer's, and been a volunteer for a long time.
Connie?
It's Connie Kugel. I'm an associate professor in the Department of Gerontology at VCU and the Virginia Center on Aging. I run the Alzheimer's and Related Diseases Research Award Fund for the Commonwealth of Virginia. So we're right in the middle of our season now. Some people have been very helpful in volunteering. We do rely on volunteer reviewers, so it's wonderful.
It's great to have you with us. Laura?
Yeah, hi, I'm Laura Bowser. I'm the chair of the commission, and my background is actually in HR and business. And I have been a longtime volunteer with the Richmond Area Alzheimer's Association and a board member. And what brings me to the commission is my mother, who passed away with early onset Alzheimer's a few years ago.
And Carol?
Sorry. I'm Carol Manning. I am director of the Memory and Aging Care Clinic or Memory Disorders Clinic at UVA, and I'm happy to be here.
And Fonda? Hello,
I'm Fonda Neal. I am staff at the VCU School of Nursing. I coordinate the doctoral programs there, and I am also the primary caretaker for my mom, who has moderate stage Alzheimer's.
Okay, did I miss anybody that I just can't see? I think I at least got everyone who's here, right? Okay, great. Well, thanks everyone for being here. This is our time to look at the agenda. We have a motion to adopt the agenda as is, or any changes?
I'll move to adopt and changes.
I'll second. This is Laura.
Okay, we have a movement to adopt.
Do a quick roll call. So the motion on the table is to adopt the agenda as presented. So please vote when I call your name. Lana Sargent,
Aye.
Carol Manning,
Hi.
Fonda Neal,
Aye.
Connie Kugel,
Aye.
Laura Bowser,
Aye.
Margie Shaver.
Aye.
Okay, the motion is carried and the agenda is adopted as presented.
Great. So our next item of business is to approve the minutes from our March 1st meeting.
Well, you skipped over public comment, sorry.
Oh, sorry. Were there any public comments?
No, there weren't, but
We should
would
have
you like to
earlier
acknowledge
meetings. So forgive me today. Do we have any public comments logged? George, you said none.
No.
Okay. Now we can review and approve the minutes from March 1st. Would anybody like me to go back through them at all or update? Okay. Okay, so do we have a motion to?
Alana, you can just adopt them if
can
unless there's
adopt them
any
without any-
changes. Does
Okay.
anybody have any changes or?
Okay, we can adopt the minutes as they are.
Yeah.
Great. Okay, so I thought maybe just doing a quick review for anybody who may have missed the last meeting or kind of where we are in our process. But remember our 2 state plan goals are regarding increasing the numbers of projects aimed at better serving underserved communities, and also aimed at lifting participation in research of people from underserved communities in research. That's been our kind of guiding goals for our work group. We have adopted a platform which was passed at our last meeting, and the update is that George and I sent our application in that was approved by the commission to VCU for the capstone project, and we heard back that we should probably get assigned a team in August who will be working with us, but there's lots of things that we can do in the interim time frame. Just as a recap, we had talked about needing or thinking about a platform in which we could connect researchers and potentially caregivers and individuals who are interested in participating in research across, and providers who are interested in engaging their patients in research across the state. And there hasn't really been a platform. And we talked in this work group about what that platform might look like. Would it be a website? Could it be a conference that we would hold? How would we engage this? And it turned out that we have the opportunity to develop an app that would be specific for the commission, that would allow individuals to view and potentially connect with research that's happening across the state. And this is very conceptual at this point, and really for our work group to develop. So all we have at this point is the proposal in and the workhorse behind us to create something, right? That would be an app that could be user-friendly. So we have lots of brainstorming to do at this point, to be thinking about, how we want the app to look or what we want to do with the app. We've messed around with talking about data collection and so forth, how we're going to make the app usable, what it's going to look like, all those types of stuff. And I think that those are things that we could start brainstorming about now, before we get assigned a team. And then I think the second thing that was talked about within the group was this, how do we reach the community to get some community feedback? At what form would we like to use? There was some discussion potentially also about engaging the community in a potential conference like process, or even getting some feedback from community partners about what this might look like. So now that we have a platform, I think we have to decide as a team, what are next steps for us? Do we want to brainstorm about what this might look like, what we could have in it? Yes, Connie?
I have a question. I'm trying to
Yeah,
find the hand up thing, but all right. So who would be the? And I apologize, I had to miss the meetings so far, but who would be the audience? Who would be the users of the app?
Yeah, so that, I think we should define that within our group. What is the audience? all of that is still very loosely based, right? Well, I think as a group, we should sort of make sure we're all on the same page with who we think that group is and what the app should be a part of. I think initially we just talked about it being a place where people could access or post, right, their research that's happening. And then individuals can connect in with potential work that's happening across the state. But then also we talked about it being a place where data collection can happen, right? Or a repository.
Somebody wants to do a survey, is that kind of thing you're thinking?
Yeah, it was brought up when we voted about it, but so maybe a good place to start would be with who we believe the audience would be for this app, because we've talked about all kinds. We talked about researchers, we've talked about providers, we've talked about caregivers, we've talked about who would be using this and what is really the focus of it.
Are you thinking that clinical recruitment flyers would be posted there?
So we've tried out some flash presentations. That was what we did at our last group, where Pam Teester and I did a flash presentation, kind of video flash presentation. I don't know if we can do videos on it, but certainly flyers could be posted up on it. Yeah. So I guess that's the big question. Sorry, go ahead, George. I was going to say who would be our audience, but.
Yeah, can I just, so putting it in a slightly broader context, so I think everybody who's on the commission is aware of this, but maybe not everybody out in the work group is, but so the commission is working on a broader Dementia Capable Virginia initiative, which would bring in a number of different things, including this, but also including materials that are that we're developing or have already developed that are aimed specifically at families or individuals living with dementia who are looking for information or resources. And basically we do, I guess one of the thoughts we've had is that the starting screen would have three choices. So for people in the community, for researchers, and for providers. But the provider aspect of it is probably what we've discussed the least, and so we may not want to touch that at the moment. But in terms of the consumers and the researchers, it's for the researchers, we want to help them learn what other researchers are doing in the state in the dementia space, and for consumers, we want them to be able to find out what research is available and what who's recruiting for participants and things like that, with the potential to possibly. So this is discussed at the last commission meeting, with the potential to link into a data collection like RedCap or something. So yes, so people could do a survey through it. We don't know exactly what's going to be technically feasible, but I guess that'll be something that we'll need to discuss with the team. But it's great to have lots of ideas that we can present them with, I think.
George, can you just tell me the difference between dementia capable and dementia friendly, or are they interchangeable?
So that's a great question, Connie. And the dementia state plan is really intended to be a blueprint for a dementia capable Virginia, and so that's where we pulled that name from, and it's aimed at the setting up the systems and supports to ensure the best care and support and education available for caregivers, professionals, et cetera, in the dementia space. Dementia friendly, on the other hand, is those community initiatives and the Dementia Friends initiative, and those are aimed at just raising awareness generally about dementia and knowledge, and also at reducing stigma. And then the dementia friendly communities are about that kind of rounding out the dementia capable stuff. So if you have the systems to support people, then we want to have the broader community in having a certain level of dementia awareness and understanding so that people can fully participate in their communities.
Great.
Does that make sense?
Yeah, thank you.
So dementia friendly would be a component of dementia capable, but not necessarily vice versa.
Yeah, George thinks that we did talk about the dementia capable being part of the platform, as resources. And I like the 3-view option, where you can choose to go in to different resources potentially. But I still think Connie's point is who's our user is well taken, so who do we want to target with this? And if we do target that individual, how do we, if it is the community, is it just the dementia capable resources that are there, or are there other things that need to be listed within that group? And for the consumers, you had provider, consumer, and what was the other one, George? I had
Research.
community, but it kind of, what's that? Researcher, right?
Researchers, yeah.
Okay, was there any other one that was mentioned previously?
I don't think so.
Okay. Any other one that other people can think about that we're missing?
Community's pretty broad. You're gonna.
The community is really, well, researcher, provider, and consumer, right? But I don't know if consumer is the right term, right?
No, it's not.
Just a
So
handy label for us.
it is. Is it the because
be
it could include the
caregivers?
caregiver, but it could also
Yeah.
include someone who maybe is just more recently diagnosed too, right? So
I'm not big on consumer myself. It sounds like we're selling a product.
Yeah.
yeah, no, we need another term that sort of is umbrella for anybody who might be coming in.
So community, does a community do it?
Is it
I
too
don't know that
broad?
anybody would know what that means,
Okay.
Yeah.
community. I get Laura's point, Lana's point about caregiver, but I still think that might be the best word so far anyway.
So for the dementia roadmap, where the subtitle is a guide for people impacted by dementia.
That's
But
everybody.
Yeah, it's everybody. Yeah.
I know it's kind of, we're brainstorming at this point, which is, really the development phase of this, but I wanted to just, like, if I were looking at an app, sometimes the way I see apps developed, they might just have a term like me, or hey, what, it's a very simple, like, it's, if it were me going to the app, that would be the area I would click, especially the way I've seen the engineering department develop apps before as like 3 just areas in which you can go in, right? That'd be the provider, the researcher, and me. Or some other term that describes you coming in. Margie, I'm looking at you as the marketer, right? It's
So I just looked up synonyms for consumer, and they are client and user.
user or client. Kind of like client.
I did the thesaurus and got au pair, custodian. I'm really not seeing anything that I really like there. What do we think, like a percentage wise of the person that is a caregiver compared to the person that has Alzheimer's? Do we think it would be like 75-25? Do we think it 10%, 90%? Because we may not be able to do everything on that first page that we would like to do. What do we think that it would be a majority of? Is it caregivers, and is it a large majority? Or do we think, hey, that could be about 50-50 there?
Fonda, what do you think? I feel like you've got.
I
good
feel like it would
perspective on
be
it.
more caregivers than those with Alzheimer's.
She's right, it will be. But I like what George was saying. If we just said people dealing with dementia, then you're inclusive. So you don't want to exclude anybody. You wouldn't want to just say caregivers by themselves.
Yeah, then you run into the issue of people who don't identify as a caregiver. So they look at it and say, well, this isn't for me.
Yeah. Some of the new verbiage from the Alzheimer's Association is now living with Alzheimer's. So maybe if we could come up with something, and I know living with Alzheimer's to me is someone that has Alzheimer's is what it says to me. But I know that that's kind of instead of them saying someone's suffering from Alzheimer's or something like that, they now are saying living with Alzheimer's. So if we could come up with some kind of something like that.
I'm sorry, Margie, go ahead.
No, that's good. Go.
Even if you are caring for someone, you are living with Alzheimer's. Maybe you don't have it yourself, but you are living with it. Is it
Yeah.
in general, is living with Alzheimer's, does that refer to only the person who has it?
I think with the Alzheimer's Association, that's what they mean is you're dealing with or working with or whatever, someone living with Alzheimer's. It's someone who has the disease,
Okay, so
is what they mean by it.
with it.
Yeah, I think that term is pretty much used for folks who have a diagnosis or are living
Yeah.
with.
However, no matter what term we use, we want it to be broad enough to encompass individuals who may potentially be diagnosed with early onset, mild cognitive to late, right? And potentially those who are caring for them, right? That category, whatever that category gets labeled, that's the group we're talking about.
I think so, yeah.
People impacted by Alzheimer's.
I don't like impact. It sounds like you're in a car crash.
Okay. affected
That's why I
by
Affected.
Alzheimer's. Surrounded by Alzheimer's. I don't know.
That's why I said dealing with. That's the term we used when we did a project, because it's a lot to deal with.
So we
How
also
about
want to include
memory
this.
and me. That's my advertising person. Memory and me, rather than make it a person or a subgroup of people, it's a category that describes something. I guess that's the direction I'm heading, right? So memory and me or somewhere along those lines might say, well, I'm a caregiver, so memory or I guess I'm leading us away from describing a category of persons and leading towards more a descriptor of what might lead someone into that category, right?
Maybe we need four titles instead of 3. I mean, can that work on an app? Will that, is there room for something instead of trying to put the 2 into 1, just add another category? Because it really is different if you're a person that's caregiver or the person that has the disease.
Right. It probably all depends on how much what are the resources that we want to provide and how much do we want to provide for each group, right? Caregiver seems to be an important category. I think Fonda's right. Caregivers are absolutely going to be looking for resources.
Isn't this something the commission's going to decide? I mean, George started saying, here's what they're saying. They're going to have 3 boxes for people to go into. And can we just let them tell us what those boxes are?
We just have to decide who our target or audience is. We don't have to decide on the terms per se. This could be something that I think evolves certainly over time. But we probably have to decide as a group who our target audience is.
Yeah, and the commission has tasked this work group with the capstone project. So,
I see.
So yeah, here is where the magic happens, Connie, and then the then the commission can weigh in after we've
I get it.
put some thoughts.
Try, Connie.
Yeah.
And we don't have to have a definitive decision, right, on all these terms. Absolutely. But if we have some idea of where Connie was pointing us is who's our target audience, then we think then the next step is, what's the information that is needed, right? Potentially to be available. What kind of resources need to be available, and then potentially some crosswalk, right, between those different groups is may want to have access, but that's all could be built in, right? But I think until we decide who the audience is, it's hard to tell what kind of resources we'd want to put up there, right? And who would be using them and how they might be using them. So maybe we don't have to decide on the specific term. We just list out what users we think would want to pick up an app I think a lot about what Fonda told me when she first told me that her mother was diagnosed and how she was looking for resources. And specifically, she was looking for research that she could enroll her mother in. And Fonda, can I put you on the spot to share that story? Because I feel like it is a little bit telling of what we're trying to build here.
Well, initially, yes, I was looking into clinical trials, things of that nature initially. But I quickly realized that because my mother was at an assisted living, and actually I moved her a few times, it just wasn't going to be easy to place her, particularly if I had to take her to a place to participate in that study. It wasn't going to work out for her. But in the process of looking for a research study, I was also looking into resources for myself as the caretaker, and also information to help me learn more about the disease. And I found myself there's just loads of information, right, on the website. There really isn't just one. Yes, the local Richmond chapter, Alzheimer's Association was very helpful, but there are other resources as well that I found helpful for me as a caretaker and learning about the disease. So if there's one place, even if it links to other things, is helpful as a caretaker. And then I think folks who are in early stage, or maybe they're not in early stage, but have the ability to be, to use an app, it would be helpful. I'm just not sure, because of the disease process, how many of those folks who are living with the disease would be able to, would be interested in using the app.
Well, MCI is a pretty big category, isn't it, Carol?
Mm-hmm.
Yes, it is. And actually, I question as you were speaking, I was wondering, what is it that was the Alzheimer's Association helpful, their websites, and what was lacking and what can we add that would improve upon what they have?
I think for me, I wasn't, and I'm sure it's there, it just wasn't, it's probably under several layers in the website. Examples, videos of behaviors for different stages. And what does that look like? What are ways to respond to that person when they're exhibiting certain behaviors, saying certain things, because there's certain things that certain ways you respond or communicate with your loved one that will produce better outcome, so to speak, or be, more positive response from that person.
Okay,
Right.
so it sounds like not easy to find the things that you were looking for. You're not sure if they're there, but behavioral management or intervention stuff in particular would have been helpful.
Right.
Thanks.
Well, when people used to call me, that was the first thing I did, was refer them to their local chapter. And so I think that's a really good place to start, because they have this caregiver kit, so they're not overwhelmed with information, which can really be a problem. But in terms of what we're going to put on the website, I'm wondering if we don't want to focus on state-based, do we, we can link them to other things, but I would think that that would be what the advantage of the commission is, if we could make it more specific to Virginia. And I also wonder what's up on All's Possible that we'd like to pull down. Has anybody even looked at that lately? I haven't.
So with All's Possible, I mean, the page of links is pretty comprehensive. But a lot of those are national. And there are some good training materials and things that are not necessarily aimed at a general audience, but more specific. So there's the micro learning for primary care physicians, which could go under the providers section of this app.
There's stuff for CNAs, and so I mean, yeah, that's targeted.
Yeah. That's the links, and also the information about the memory assessment centers could translate very well, I think.
Seems to me, just kind of thinking out loud, that what we need to provide is like you said, state of Virginia, but even more local than that. There's all kinds of places to get stories and this and that and such. But if I go somewhere and I'm looking for something that can help me in Roanoke, Virginia, I may not necessarily be able to find that on a larger site, or a site that has all kinds of information. That I think we need to think about it being really local, and how we do that for the entire state, that we cover the state, whether it's Richmond or it's somewhere in far Southwest Virginia that has no resources at all.
Well, that sounds like you're describing Virginia Navigator.
Exactly.
So which we could most certainly link to, and that would be a key resource for folks. But I'm not sure we want to try and duplicate what they're doing.
Good point.
Yeah, I think so. This conversation is reminding me of a pilot program. I think I've mentioned it before. It's called Prella. It's a web-based service that Genworth Financial has developed, actually, and it's free for any of their long-term care insurance recipients. That the goal, obviously, for them is to keep people out of nursing homes. But it's a web-based service that actually has concierge support for either caregivers or those with Alzheimer's. And the way it works is you go in and you kind of figure out what stage you are, and you get healthcare tips and a person that will actually give you legal services or send you adult daycare information based on where you're located. I think it's super, it's taken probably 10 years for them to get to where they are now, just to pilot it. And it's so overwhelming, the amount of information. And I think that's what we're kind of discussing with like the Alzheimer's Association. You don't really know what your resources are. And I have a feeling that if we went that route, it would be so in the weeds that we'd miss some of the bigger information that we're trying to just get out right now. So I don't know. So yes, there's a huge need for that. But then at the same time, I think we need to think a little bit more high level. What are the basic things that people need to know? and how do we get that out to them?
So is that like a starter kit? So these are the, so you're wondering and worried, or you're thinking about discussing this with your doctor, or you may have discussed this with your doctor and you didn't really receive a lot of forward information. So we can help fill in those gaps. Is that what you're?
Yeah, like that. And also too, I mean, all the different state resources, most people don't know what those are. So like even we talk about Virginia Navigator, but the average person doesn't know what that is.
No, that's true.
So having a conversation on there of like, these are the different services and here's what they do, and linking it all in one location so that people don't have to just go to all these different sites. I feel like everything's just so siloed.
I like the idea of having a little descriptor. So you want some general information about types of dementia, go to alzheimers.gov or alz.org. If you're looking for specific services and supports, this is your portal. It's like that.
So
Yeah, like-
what I'm hearing is like, it would be helpful for us to sort of untangle the information that's out there for people. And we certainly talked about that, not wanting to create resources that are already out there that people have spent enormous amounts of time building. But it does sound like we could potentially untangle the resources for them and categorize them and organize them in some way that makes it easier, like one collated place easier for them to find. Which is kind of what we were talking about with the other categories too, at least for research, right? You know, kind of making, rather than having to go everywhere or potentially even having to know those key terms, right? To put into the search box, that we would create a space in which it was really easy to view potential research. So if that sounds like the framing potentially of what we're trying, of what we could do with all these different groups. But our goal with the app, I'm just reflecting back on hearing, that the goal of the app would be to synthesize and organize things for people when they come into this space in a way that makes everything more usable and accessible. How's that sound?
I think as just someone that was a partial caretaker, that is, to me, I think what would be the most important. I think just even being on the commission for 6 years, I'm still learning about programs to this day that existed that I had no idea. And I don't think I would have gotten that information either, you know, even through the Alzheimer's Association, because they have a very different hands-on sort of caretaker approach. So just having it all in one place that sends people with descriptions too about what it does and doesn't do.
Yep, ditto.
Okay. So if we adopt that framework for that, that framework of thinking, and we apply that to caregivers, you know, the provider potentially. We also, I think the good question to lay out on the table too is whether or not we can do all these categories and whether or not we want to do all of them. I think that's a really important way. And what we do now, remember the project is a legacy project. So we can start small. We don't have to take all of these on all at once. We can take one piece of this, or at least the piece that we feel like is most manageable, build that. And then as we go through the legacy, they can build another piece of that for us. So we could just start even simple and say, we're going to figure out where the dementia capable, where does dementia capable fit in here, so forth. I'm just laying that out there. And we might want to also decide which one we want to start with, right? Which category, because even as we get into the weeds, like someone said earlier, with one category, we may find that it takes quite a bit of time to just walk through, say, all the resources for caregivers specifically and categorizing those. We could spend kind of one fall, complete fall, kind of organizing those. So how do people want to approach that aspect of it?
I liked what George said about services and supports. You can have something also for information, but if we could, if you want to talk about starting, the first things first, I think state level services and supports is a good place to begin.
What do others think? It may not be feasible for us as a work group to do all those categories all at once, right? Research, because they may potentially have different, I think the two most disparate ones would be like the researcher and then the caregiver. Those seem pretty disparate as far as content that may go in there, but I may be thinking about it wrong. As where provider or the person coming to the app or the caregiver may have some overlap, potentially in the services and supports that they use.
Yeah, I agree that we should probably focus one area and then build over time. I'm thinking maybe if we have a framework that we know we can design the app a certain way, we don't have to necessarily build the entire app out, just as long as we approach it sort of, we know that there's going to be a section on this at some point, so they build it that way from the front end. But I guess my question is, and I don't know if George knows this or not, who's the primary audience for All's Possible? Do we know?
Is there
Well,
anybody?
I wish I'd answer that question.
Is there anybody out there?
So.
Do they track data, George, on like who uses it?
No.
Oh, that's the other thing we do want to do in this group, right? We want to track that data.
Yeah, we get no metrics from it at
we don't know
all.
if anyone uses it.
Sorry?
We don't
What
know
did you
if
say,
anyone uses it.
No,
We don't
we
even
don't.
know how many times it's viewed or.
No.
Okay.
I know we've talked about this before in this group too, specifically, I think. Yeah.
Which is one reason we're looking at other ways to engage with the wider world. So all's possible. It's maintained by a third party that owns the content, and we currently have no contractual arrangement with them, so it's kind of up in the air.
Who needs us the most? Is it caregivers or researchers or providers or?
All the above.
I keep going back to the getting people into clinical trials, because that's just what I've been kind of studying for continuing education, is looking at these health disparities and how are we getting people to bring that into the forefront, trying to get them vaccinated, but the same problem occurs. There's a lot of overlap when you've got people trying to think about the history and so I think the underserved, Lana started with that, the underserved community should be definitely part of our focus. And the one thing that we haven't done as a work group, and we kept talking about in the olden days, we kept talking about trying to get the researchers connected with each other, and then also helping them in terms of recruiting, just in general, because it's a chore. If you've got to do that, we spent a whole year trying to get people, caregivers, to come to a mindfulness-based stress reduction intervention. So any way we can help with that, I think, is important. And so we've got a history of trying to help with that. And then also looking at the state plan, we need, I know that's part of it too, is helping to promote collaboration among the researchers in Virginia. And so that's where the RDRAF can come in and be helpful. So, oh, and I also wanted to say a place where there's a big gap is when you're talking about people with lifelong disabilities developing Down syndrome. And that's a place where there's just not a whole lot of information, and I think it's starting to get big, but there's a hunger out there for that. So I don't want us to forget that. Kind of off topic.
I think that, Connie, that's a good point, especially, I mean, that group falls underneath an underserved, population. So, and I think you're right. I mean, our two goals for this is to increase the number of projects aims at better serving those communities. So that's connecting researchers, right, with communities, right, or with individuals. Right. And then lifting participation in research of people from underserved communities. And so when we originally started talking about this, actually, we were looking at it from the lens of what could we create that would bring, like we said, again, that platform of sort of synthesizing, organizing all the research that's happening, where people could submit a very simple, short form where providers and caregivers and individuals could go in and make a connection with work that was happening right across the state. So that was one of the buckets that we had talked about. Different than services and supports, right?
Well, I think with the demise of the VNI, that's a really useful gap to fill. And I mean, it does, if we focus on that to begin with, then I think we can start, we could start adding in, if people are starting to look at it to connect with research, then we gradually start providing some resources as well, then, that makes it more attractive for those users. But I think filling that gap of connecting researchers with each other and with the community is a good place to start as our main focus.
I don't think VNI's gone away. They started their 12th round and they were looking for letters for March 2021. I know they skipped a year. They didn't do round 11 as far as I can tell. Oh. But now they're doing 12. So.
So I haven't been able to get in touch with anybody about it.
Since you and I presented, I think. What was that?
Yeah.
19?
End of 2019.
Yeah. Carol, have you heard anything on VNI?
Not a word in a really long time.
Yeah.
I also think the VNI's focus was just a little bit different. The meetings that I attended seemed to be very heavy in connecting researchers with researchers. And it was also very heavy biological. That I remember, but Carol, maybe you had a different perspective, like some of my engagement. I'm not sure what the overarching goals were for.
No, that my impression matches yours, but I thought they told me that either they weren't their funding wasn't renewed or they were disbanding in some way. But Connie, you think that that's not the case?
Yeah, I was just looking at it. I was reading the minutes and reminding of that, and went to their website, and who's that guy's name? It's Marchand or Merchant or
Randy Merchant.
Randy Merchant.
Randy, yeah. And of course, we used to know people who worked there, Suzanne Taylor and Karen Bell, but they're not doing that now. The thing about VNI is it's so much bigger than dementia. So If you look, I
Sure.
looked at what they funded last time they fund, I think that must have been around 10, and I didn't, I don't think I saw anything related to Alzheimer's in there. So there's not a
Yeah,
whole,
that's true. Okay, well, that's good to hear. Maybe we won't have so much overlap. If they do reignite themselves again, then
Yeah.
we won't, yeah, be. So what I'm hearing is, I'll summarize here that maybe one of the, certainly maybe we could decide when they come in, which subgroups we might want to have or how it gets designed for the long term, but we have a short term goal, which potentially it sounds like putting research and connecting individuals with each other and potentially individuals with research would be the first one. And that does include caregivers, because you could couch that under caregivers potentially coming in to look for research opportunities. And then we could, the long-term plan, build out services and supports as kind of our second jump that we would want to make. Now we could switch that up and do it the other way around. It just depends on how we want to tackle this.
well, there's a whole nother commission subgroup that's dealing with services and supports, and we're the
and
research.
providers.
So I think that's where we go.
Okay. And there's a provider group too, right? I mean, there's a group
Mhm.
really focused on providers too. So it does not to say that dementia capable couldn't, right, be embedded in here, right, George, to start, even to get it up on the platform, because that was one
Yeah.
of our goals.
So yes, I think we would brand this as Dementia Capable Virginia because it still falls under the Dementia State Plan. It's part of, it would help achieve Goal 5. So yeah, absolutely. What then falls under Dementia Capable Virginia can be a host of different things. So if we start with the connecting researchers to each other and with potential participants, that's a good start.
Or even providers to
Yeah.
research that's happening, right? I feel like it could potentially be any user could come in, a caregiver, an individual, a provider, a researcher could come in looking for ways to connect. So how does everyone feel with starting at that point? Those fit underneath our 2 state aims. It also potentially could touch all of those different groups that we were talking about, those end users, and then we could build from there. But within the context of synthesizing, organizing things all in one place. We're not recreating things. So then the next big question is if it is going to be that we really focus on connecting researchers and connecting people, so with research, and those 2 big categories, then the big question is, how does it look? What, those bigger, I think, questions about should we engage? There's some of us who do research, that's helpful, but should we engage a larger audience on what would be useful? Pam Teaster and you guys saw, you sat through what we tried to do as if I were a researcher and wanting to put something up on this platform, what it might look like. Pam did a PowerPoint. Pam Teaster did a PowerPoint. I did a flyer. There's quite a bit to think out there. Do we want to engage some stakeholders? Do we feel like we're enough?
I was just gonna say, George, can you send me the flyer and the PowerPoints?
Yeah, they were short videos, Connie.
So,
That's right, we did in those videos.
I can transfer them to you because they're pretty large, but I can do that.
yeah, I just like to get caught up here.
Sure.
But
So-
I like what you were saying, Lana, about stakeholders.
Yeah, stakeholders. I mean, it's probably going to be more than just us, but what does it look like? What do we need to do to really think this through? We did talk about as a group wanting to be different than other sites that were out there where you had to go in and put in a specific search term, which does require some knowledge base. You have to know the terms, you have to get the right terms, right? So I think that's why we were playing around, Connie, with like just visuals. That's why we talked about videos initially, or flyer with very simple language, very short information, like maybe even a script that people give, so that you don't necessarily need to have, so it could reach an audience potentially that otherwise might not have the ability to search it in a certain way, or a broader audience, thinking differently about how we present these studies. So that's why we messed around with the videos. How do we get people to give us their stuff and get them interested? How do we track all this, information?
So can I suggest maybe we do a survey of researchers over the next couple of months,
Survey.
to see what people would be interested in, or whether they'd be interested in this, and make sure that we're not just creating something for ourselves.
Right. So would it
Um,
be an interest survey?
A what?
Just would you be interested in participating in?
Yeah, I mean, I think we've got a framework of ideas that we can present, and what would be, what would be the most useful, what barriers are you finding in recruiting participants for your research, things like that, and what could potentially surmount those barriers, and maybe if we can learn from about like a good way the best way to fill the gap, or fill whatever need those researchers identify. But I think we're operating, we've got some ideas, but we're operating a little bit blind. So I know not everybody on this work group is actively undertaking research, but those of you who are, have no doubt faced some issues with recruitment.
But we may want to survey a broader audience, George, too, since it might be for other individuals, caregivers, or it's just an idea.
Yeah.
Just a thought. Maybe we start with one group and survey the interest of individuals who would even post.
If you're going to put a survey together, I think we ought to go back and look at the focus group, the researchers focus group that we had. I don't know how long ago that was, but there's some rich information in there that might just be some kind of a guide. It's like, okay, now we know this part, we don't need to ask about that again, but maybe just go dig deeper, go down another level from what we think we know.
When was that done, Connie? How long
I think that
ago?
was before the last round of the dementia state plan, so it would have been 2014, 2015, somewhere in there. Is that right, Connie? Because I know there were the community listening sessions, and then there was a focus group for researchers. So I think
I mean, I've got the data that came out of that somewhere. You want me to send it to, because you weren't even around.
no, but I have all of Charlotte and Devin's stuff, so I can probably find it. If I can't, I'll let you know.
Yeah. No, I'm terrible at dates. I don't even know what this year is, so I can't tell you dates, but yeah, I can help you find results if you can.
Well, I think it's probably a good start to think about surveying the stakeholders who would be either using it or putting their information up on it.
I think that's really important, because one of my concerns is that this is another all's possible, which is this great thing that none of us use.
anymore.
Right.
And why do you, and what are the reasons do you think, Carol, that we're not using it?
Not me. Never occurs to me, or I can't even say that it's hard to navigate because I never go there. And I know there's a ton of stuff on it.
We used to use it a lot when they were doing webinars with the Department of Gerontology. And those really drew pretty big crowds. And there was some of our geriatric training and education money, I think, that went into that because we counted people who attended. But after those webinars went away, that's when I think it just dropped off.
Well, that's when the money stopped, basically.
Yeah.
So, but the webinars are still there. They just, one issue is we probably won't be able to connect to them. We probably won't be able to house them on any platform that we have because they're not accessible unless we have some money to make them accessible. And there's
We can just
hours.
lead people there, right?
Yeah, we can lead people there, sure.
And Virginia Healthcare Association had a whole series also.
Yeah, there's about
That
70.
was really good. I don't know how much of that was dementia, but
I'm going to ask a question that shows that I don't go there, but and look at all's possible. But do researchers post anything? Is that a place where you would go if you were looking for research? So they don't have that piece of it.
I never got that sense.
Yeah.
No, it's all the RDRF projects are there, but
Right.
But nothing else.
Well, I asked that question of Carol because I just wanted to make sure we don't do the same mistake if we do build something, right? That we whatever we've learned from the other sites that aren't being used, that hopefully we can create something that doesn't end up being not used, right?
Yeah, so I think Carol's question at the commission meeting about whether researchers would be able to collect data through this, I think is important, because we want to get some data about our users, which we just don't have from all possible. But if this could be a really useful tool for researchers, then that would bring them.
I think it would be really interesting to find out who might be clicking on an individual's file, right? Who clicked it? I mean, so like what Carol, you brought up at the commission meeting was even just some basic demographics about who's accessing it, and if they're obviously if they consent, right, to fill that part out, and then where are they going? What research are they looking at? And potentially data. I like what you said, George. Data not only that we would collect, but potentially would get fed back to researchers so that they could get some information about recruitment that would potentially help them understand how individuals look at research, or that may help them with recruitment. If it was a reciprocal data exchange, it may be useful to them as well as to us. What those data points are, we can define, right? But I think it's a good point that if they're getting some data out, it would be useful. Like for instance, we track when we enroll people how many warm contacts we get in touch with, right? Before someone says yes, and then why, some of the reasons why they said no. That stuff is useful. So for a research study that we're running now, it's on dyads. Now enrolling dyads turns out to be very difficult, especially during COVID, right? Especially with low income minority populations, because caregivers don't always define themselves as caregivers and don't really see themselves as a dyad, or there's more than one caregiver, right? But we learned this all through the tracking of who sort of we came in contact with, whether they said yes or not, right? The reasons why they weren't interested. That kind of data might potentially be very useful to people if they're putting their work up there. And we could collect it, not only, maybe we collect some data points for ourselves on the commission side, but also some points that may help them understand the reason why people didn't choose their work, or didn't choose to call them, or didn't choose what made them not connect. The things that Connie were talking about, like why we're struggling with certain recruitments and enrollment. Just brainstorming, but I like the idea of it being useful not only to us, but data that's useful to the researcher. And that might keep people engaged, yet alone that they're going to get some information that they may already be tracking as a part of their work anyways, because I know we track it. We have a screening. Carol, if you do the same thing, we have a screening form, right? And then we put everyone on our screening form, but we may enroll. So how many people did we have to talk to before we enrolled? Our total N is a thing that we look for.
Well,
And maybe that could, sorry, I was just continuing to brainstorm, sorry. But maybe that could be one of the things we asked in the survey, or try to elicit in some way. What kind of data would researchers want to get if they put their research up on a platform like this? What would be useful to them?
Yeah.
Sorry, Connie.
What would they like for us to collect? But I'm just, what I was saying was your data alone would be something that people would probably like to see. And I think if we made our inquiry specific to Virginia, that might help, because we know that, you know, people have trouble, what Vonda was saying, people have trouble with the transportation piece of it. So if we get, you know, and plus researchers probably are starting to get familiar with what are the barriers to recruiting underserved populations. But if we could give them specific information about Virginia, you know, we may have some unique characteristics.
Yeah, maybe more than just transportation, right? As an issue, or.
Yeah, I mean, some people don't like to go to assisted living facilities for education, you know, and that's kind of something I've learned over the years is they don't want to go there, which we always thought would be a really good idea to get caregivers to go there, because then they could see how nice it is. And but you know, that's just the off point. I'm sorry.
All right, so I'm going to back up a little bit. So we decided research is where we want to focus our first jump into this topic, and that doing a survey of maybe our mains, or to look back at what Connie did or what data we have on the focus groups and how that might help us, as well as George mentioned, potentially doing a survey of our key stakeholders, which the key stakeholder would be the researchers, and then potentially maybe on that survey, not only asking what would be useful for them in this platform, but also what kind of data they would like to see collected if we had something like this. That would help maybe guide our discussion or the framing of this.
Oh, you know, don't forget recruitment, but also retention. I mean, that's a biggie. It's one thing to get people into studies, it's another thing to hold on to them. And so I think that should be something we ask about in the survey. But yeah, that's a good summary, Lynn.
And would we want to focus on translational research, or would we include all dementia research? So
I would say all, all cognitive functioning research, right? Anything MCI. What do you think, Carol? Laura, do you have any ideas? Behavioral, but under the umbrella of cognitive, I tend to use the word cognitive functioning because it can fit behavioral as well as delirium, right? I don't know, Carol, what do you think?
Put behavioral separate from cognitive, but I would have them both there.
You'd have it separate, but you'd include it. Is that what you're saying?
I would definitely include it, but so there are the behavioral symptoms of dementia and there are the cognitive symptoms of dementia.
Yeah.
and what about biological research?
I'm sorry, biological, what'd you say?
Biological research projects.
It's a good question. You know, do we focus on human subjects, research only?
Mhm.
Is that what you're getting at?
Yeah, I guess that's my question.
Well, how would I know that Fonda and I found a really great study that was going on at VCU, and I sent her over to it, and it turned out that he was still working at the bench, right? So it wasn't really useful. You know, he was probably 10 years away from being able to move his work translational wise. So my question is, how would it be useful, other than to the researcher, how would it be useful to caregivers and patients with dementia if it's a bench or biological science? I'm just putting it out there as a question. How would it be useful to them? It would certainly maybe be useful for connecting researchers to researchers, right?
Yeah.
But is that our goal or our main goal?
That's one of the main places that people need to be connected because of the different equipment that's at the different universities, and we can do this assay, but we can't do nano stuff. So we've got to collaborate with somebody else. So, I mean, that's a rich area for collaborative relationships. Is the bench.
I wonder if that's a separate piece though. Where we're connecting researchers to researchers versus people to research.
It's two branches of the
Mhm.
same vein, right?
Right.
So,
Well, we could
Craigslist for
categorize them.
research. Craigslist for researchers.
Craigslist.
What did he say?
Craigslist for researchers. Well, maybe maybe it is that there is, or maybe it'll come up in the stakeholder survey that we do, that is something they're interested in, or we ask it directly. You know, if there's interest in connecting with using this platform to connect with other researchers, might be something we want to ask.
Well, that's all over the focus group results. So
Okay. So if that came up as one of the focus groups, I wonder if that would be a different section. Like if you went into it, you said, I want to connect with a researcher, you know, maybe that's a place where you go as a separate link or something like that.
Yeah, I feel like it would need to be separate because, you know, with some of these studies are going to go right over the heads of the average person that would be reading the information that we're providing. And I don't want to make it so convoluted that a regular person that's trying to actually educate themselves on it doesn't go any further because it becomes so intermingled between research and whatever this person has the capacity to really kind of absorb. So I almost feel like it's two different worlds.
Yeah.
Not to get too off topic, but I want to make sure it stays on our radar. One of the things that we did talk about early on, it was something Fonda brought up, was a potential video. And I know they have them at NIH, the revised NIH, the link, I can't remember, is it nih.gov, I think, where you can search research that's going on, but they have a video of people who've been in research. But we talked about having a link there within this section that had a video of someone who participated in research too.
Yeah, it's the Alzheimer's.gov website.
Yeah, Alzheimer's.gov, which they just redesigned. Not doing our own video, not redoing it, but making a link, you know, to that within this section. So we should also keep that on our list if that is still something I want to do. All right, we're getting close. We've done a lot of brainstorming. It sounds like we've narrowed. So we went from let's tell you how we've used our time. We've narrowed from researcher, provider, potentially stakeholder, and caregiver down to just the research focus as our first jump off point. How do we want to review that focus group? Does anybody else want to see the summary of those? that information?
Yeah,
We
I'll
could
pull
review
what
it
I
as a
have
group.
and I can share that out after the meeting.
Okay. And so we'll review that. Then do we want to be as a group a part of putting a survey together? George, how would that work if we were to put a survey out?
So my suggestion would be that I can put together a frame work and you can all give me some feedback and add or subtract to it.
That's good.
And then I can just set it up on SurveyMonkey. So I don't think we necessarily need another meeting to get that rolling.
Okay. How would
It'd be nice to have that information before VCU, the team starts to get to grips with this.
Yeah, I think that the brainstorming that we're doing now and the focusing that we're doing now is really important before they get in the room. So we can clearly say, we're focusing on this step first. We've done this work. We think we're gonna, so they help with more the design of it and what it might look like and potentially some of the terminology that might work for users that we were struggling with in the very beginning. As far as the survey that would go out, do we have any idea who or how wide, what listservs can we tap into our draft, potential researchers, VNI, should it be sent to VNI? Like what listservs are you thinking about?
So I just had a look at the VNI website and it does seem to be all about their grants. There's nothing about the focus. So their interest groups, you click on that and it is a 404 page not found. So, and when I got in touch with them, that was the question about getting their mailing lists and didn't get a response. So perhaps each of you, or if you know of people, maybe give me a few names to get started. I've got some names. I can start a list and circulate that.
A list of recipients.
Yeah.
Take everybody that was in the focus group.
Okay.
And if you don't have their information, I just give me a name. I can find them.
Okay. Yeah, we can start with that. If there's anybody new.
Pretty sure we could target some aspects of the university as without any, IRB or permissions or things like that, but let me check. Any other ideas of mailing lists or people we want to, or groups that we might want to target?
Oh, what is the Central Virginia? Well, that's just Central Virginia. The chapters of neuroscience. The Virginia chapters of the big national neuroscience conference. Like Karen was in the Central Virginia one. I know she was always trying to get us to submit stuff there.
I have some ideas too. Individuals we could just add to that list, like contacts at Riverside who do, do some research, EVMS. Carol, I don't know if there's anybody at your institution would be willing to give us feedback to.
So who are you giving
survey?
feedback?
These are researchers.
Give them the survey or?
Yeah, have them take it. Give us feedback.
Oh, pilot.
So you mean I could ask people in the memory disorders clinic to take it?
Yeah, anybody doing research that might potentially be a stakeholder.
Mm-hmm.
So we're trying to put together a pilot list. So how big do you want that to be?
What do you all think?
And you want to ask your friends is what it is.
Yeah.
Okay, now I get you.
So maybe we can brainstorm about this, how far we want it to go, if people have lists or where we want to share it to. I would say the broader we could go, the more, certainly if we can get across the state.
Wait, can I just clarify?
right.
So
Yeah.
Connie's mentioned a pilot, but are we thinking of having a pilot or just we
There was like an
we as
informal
our
survey.
group decide what's okay on the survey and then send it out without a pilot? Or are we looking to get some feedback from some non-work group members before we send it out?
What do you all think? I was thinking an informal survey from our group, but what do others think?
I think informal is fine. Yeah, I think it's more important that we have volume of response.
Okay. So if you're happy with me putting together a framework that we can add to and do that over email over the next few weeks.
Yeah, we gotta kind of hurry up.
Yeah.
Yeah, I think it would be good to get as broad, maybe as wide the scope.
Yeah.
I mean, wide as far as demographic, like across the state, the Commonwealth would be helpful, right? Not just the Richmond area. So, okay. So we have that as an action item. Hopefully you'll give us some information for the next time we meet too on this topic. And then maybe in the survey, we ask about what kind of data they would want us to collect too. That would help direct that conversation. And then we probably should all be thinking about kind of what data would we want to collect or need on the commission side too. So maybe that could be something we put on the agenda for next time too, is just what would we want to collect, and could it be potentially some overlap with what would be going back to people? I think that's it for my summary, unless I forgot something. Does anybody else have any ideas? All right. All right. I would say that was pretty good considering we're at the end of a workday.
At least it's not Friday.
Right, it's not Friday, but it feels like it's well, it's really Tuesday. I was having a hard time in the very beginning, but I'm feeling like we did solid work there. We've narrowed down, although, it's still on the table. Certainly we should probably think about it. The resources that we talked about, resources and supports could still be a build-in, but I think the challenge for us is that everybody's acknowledged there are already a lot of resources out there. We don't want to recreate them. So our job may be in that long-term phase to just synthesize them and bring them down, which could be the second phase potentially of what we do. So we can put that in our list.
And connecting folks with the resources that we already have within the commission.
Yeah. And maybe potentially the other work groups, whatever is coming out of those work groups, right?
Yeah.
So. Okay, this gives us a starting point, a jump off point, and it fits underneath the state aims, right? It's a direct response to the aims that we have for this group too.
Yeah.
So, great. Well, that's all I have. Does anybody have anything else? I just want to thank everyone for all the thinking, brainstorming.
No, I think this is great.
Okay. We have anything else, George?
No, I'm all good. Thank you, Lana. It was
Okay.
good meeting.
Thank you.
Good meeting.
Thank you.
Yeah. Great.
You can adjourn then.
I was just about ready to do that. I was like looking at the minutes. Like, is there a motion to adjourn the meeting?
No, you can just-
Do I need to
declare.
motion it?
You can just
We're
do
gonna-
it.
We're going to
Just do
adjourn
it.
the meeting.
There you go.
Bye, everyone.
Bye.
Bye.
Thanks,
Thank you.
everyone. Take care.